So in this video, we're going to talk about congestive heart failure. And really what this is, it's when you have a heart that is failing, so you had some left ventricular failure, and so it cannot pump blood forward effectively. So you have blood that's coming into the lungs, but it cannot be pumped out that well because of this failing heart. So what ends up happening is fluid ends up collecting in the lungs. And that has a couple of effects. You get dilation of the pulmonary vessels, you get fluid that leaks into the pleural spaces, and fluid that leaks into the interstitium and the alveoli. And you're going to see this show up as a couple of different things: cephalization, pleural effusions, pulmonary edema, curly B lines, and the last thing you'll see is cardiomegaly, which is as the heart starts failing more and more, it just gets bigger and bigger. So now let's take a look at this x-ray over here and see if we can demonstrate some of those changes. The first thing you'll notice down here is we lose some of that, the sharp costophrenic angles. And so this one kind of gets cut off here, so we don't see it completely. So we get the blunting of the angles, and those are the pleural effusions. And if we zoom here to the other side, you'll see very faintly these lines that kind of go like this. And that's fluid that has leaked out and into the interstitium, and these are called curly B lines. Then the next thing that we can point out is the cephalization, which are the blood vessels that you can kind of see kind of going up like this. Normally you shouldn't see the blood vessels at the top like this because gravity doesn't allow them to be as full of fluid. But since there's so much extra fluid now, you can see them. And in this x-ray you can just barely start to see all this whiteness that's kind of collecting over here. And that's pulmonary edema. But that can get confusing because also what you're going to get is very full hilum as they start collecting with fluid as well. And then the last thing we need to talk about is this cardiothoracic ratio, which is about half the size of the chest. And that's a sign of cardiomegaly. And in case you were worrying, this thing here is a pacemaker. Wondering, not worrying. So let's take a look at these chest x-rays over here. Now, and this is again CHF, and we can see a lot of the same things in here, including cardiomegaly, the full hilum. There's a little bit of cephalization going on as well. And if you look at the lateral x-ray, you could actually see fluid in the fissures. The fissures are pretty easy to see here because they're filled with fluid. And down low, you can see that these costophrenic angles are pretty blunted. In fact, you kind of lose them. You don't actually see them even here because they just got cut off the x-ray. So in this next x-ray here, you could see again very similar things. You can see the cephalization. You can't see the costophrenic angles here. They are not on this x-ray. Curly B lines also may be missing there. The cardiomegaly, yeah, that's definitely there. The hilum are kind of full, not as full as they were on the other x-ray. And if you look at the lateral over here, you can see a couple of things. You can see much better how full the hilum are here when you look at it like that. And again, the CP angles are a little bit blunted. We lose them over here. Now, in this last x-ray we're going to look at, you'll see a lot of the same things again. Heart's big. Can't see the CP angle here. This one doesn't look too bad, but what you can see really in this one is all these, like, this fluid collection here, this fluffiness all over the place. This is alveolar edema, pulmonary edema. That's throughout this x-ray. And you can see here at the top, actually, it says in resus, meaning that this person is being resuscitated. And so they probably came in pretty sick. And so this is our video on CHF. Thank you for watching. And just make sure that you remember all of these little points here are the things that you want to look for in a patient who has CHF. Thanks for watching. Goodbye.